It's World Tuberculosis Day today. The day is meant to raise public awareness about the health, social and economic consequences of TB. That's according to the World Health Organization. The theme for this year is Wanted Leaders for a TB-Free World. It focuses on building commitments to end TB on all levels of governance. The WHO says it's a critical theme given the upcoming high-level UN General Assembly meeting on TB later this year. The WHO says 1.8 million people died of TB globally in 2016. That makes it the top infectious killer worldwide. Let's get you more now on that. I'm joined live in studio by Kelly Kalaba. He is a tuberculosis advisor at the University of Maryland's Kenya program. Kelly, thank you for joining us today. Why is it so important to mark Tuberculosis Day? Yeah,
it is important because, of course, this is the day that we take the opportunity to heighten the awareness to the public about tuberculosis, or rather the day we all call stakeholders and all members of the world to take some time and think about TB. Right. And of course, just as various data has shown worldwide, you realize that TB is one of the big killers in the world. For example, last year we had about 1.8 deaths which occurred because of tuberculosis, and we have close to 10 million people getting infected. Now, if you look at what this causes, of course, is quite catastrophic to families, nations, and also the resources of particular countries. Right. Now, you talked about creating awareness, and when we talk about that here in the continent, is enough being done to do that, and what are the challenges when you talk about creating awareness here? Yeah, I would say enough has happened. It's still ongoing, but we still need to improve, especially the way we run healthcare systems, and also just improving access of TB prevention, care and control, services to the patients. Yeah. For example, of course, most parts of Africa, we still need to improve, access of diagnostics. For example, we have some of the very latest, innovative, quick, and very accurate, laboratory tests that can detect if a patient has TB. And to that extent, it may also tell you within 2 hours, for example, that the patient has TB. Most of the regions have not received these diagnostics. We're still using the old smear microscopy, where we know that we still miss quite a number of patients. Studies have shown that almost 40% of these patients could be missed, yet they were in the healthcare system coming for care, in the health facilities. Yeah. Now, you mentioned healthcare, and obviously that is key to fighting tuberculosis. It is an agenda of the AU by the Agenda 2063 to improve access to healthcare. But when we talk about healthcare vis-a-vis tuberculosis, what are the measures being put in place in the continent to address that? Yeah, just to say, in 2014, 2015, UN country states through WHO, they agreed to have a partnership, what we are now calling End TB Strategy, which is running for 20 years from 2015 up to 2035. And of course, it's a request of countries to improve the way they are doing things. For example, in terms of diagnostics, to make sure that these services are actually accessible to their citizens of specific countries. In this document, it also gives a guidance on how to improve what we call active case finding, because we are realizing that some of the patients visit us in various facilities, some are in the community, but we still miss them. So there is improved way of trying to improve what I can call, catching patients. For example, simplification of symptomatic screening. And you're also educating healthcare workers to be on high alert or to have a high index of suspicion to detect TB and send these patients to for diagnosis and possible treatment. And also just to say, even things like X-ray, we've seen, especially in countries like Kenya, where we have rolled out new gene expert machine. This is a test that detects mycobacterium through sputum quite quickly, within 2 hours than it was before, and it's quite sensitive. Medical workers are kind of forgetting to use chest X-ray, which detects quite a number of also cases. But also there are discussions at the policy level for countries to start considering, and especially I would say also like Kenya, to make the access of chest X-ray to be much easier as it is now.
All right. Thank you very much for those insights. We had in studio Kelly Kalaba talking to us about World Tuberculosis Day and what's being done to combat the disease in Africa.